So today, the UK reported a record 33,470 new positive COVID tests. So what? So what? What does this number mean that gets bandied about by every media organization, by governments when they want to push their agenda on you? It's the new COVID cases. But what does that number actually mean? Is it people dying? Is it people in the hospital? No, it's nothing like that. It's positive cases. And today on the show, I had Dr. Martin Kulldorff from Harvard Medical School, who's one of the authors of the Great Barrington Declaration. And he said to me point blank, Brian, tests don't matter. He said the more tests that you perform, the more cases that you're going to get. So the cases don't matter. He said the more you test, the more you're going to get. And he said you cannot compare these numbers back to the April or the May numbers of this year because back then we weren't testing. He goes on further and said it makes no sense to test anyone under the age of 18. He says you're testing a lot of asymptomatic people or mildly symptomatic people out there, and these numbers are completely giving us a disproportionate response to this virus. He said what matters is hospitalizations, mortality, and excess mortality. That's what really matters. He says in a hospital situation, if you have an increase in the number of people there, he said you can directly tell that there are people suffering from a disease or could die. But he said just testing people for the hell of it and seeing a rise in case studies tells you nothing as a doctor. And yet that is the number that is pushed on us constantly. And our government uses it to change policy and currently locks down the entire country of the UK in Tier 4 lockdown, most likely because of that number. And we see it all the time in the New York Times. The US is over 1 million in a day. The world just hit this. But what does that number mean? It means absolutely nothing. And so the thing we really have to look at is the hospitalizations, the mortality, and the excess mortality. Again, a really important metric that we need to talk about here, which is the excess mortality. And we're seeing this in certain countries like Sweden and in the US, where we actually see that more people are dying because of the lockdown. So you also have COVID deaths, but you also have lockdown deaths that are happening, deaths from cancer patients that weren't treated, and a whole other range of factors that contribute to that massive number of COVID deaths. So this is one of the things that it's important for us to talk about right now. Stop looking at the positive COVID cases number. It's not about that, because the more you test, the more cases you're going to get, and then you can choose any public policy you want to go ahead and ask us to do things like locking us down, which affects our mental health, which affects hunger in this country, which affects all these other treatments that aren't being used. And Dr. Kulldorff said today that all these things are being pushed out into the future. The cancer deaths, the mental health issues, the damage to our youth, the hunger, the drug addictions, the domestic abuse, all of those damages are being pushed out into the front. But he said, Brian, governments are supposed to be thinking about our long-term interests. Scientists look at long-term interests. They don't look at this short piece of data and then base all public policy on that. He went further to say, Brian, I've been working on game plans for countries for 10 or 20 years of what we do in a pandemic. Europe has as well. And yet that all went out the window when COVID hit in March and politicians started to make decisions based on emotion, based on covering their own inaction and poor decisions. And now we're faced with what's going on. He did cite Sweden as a very good example of what happened, but he also said that we need a targeted response here. And that means protecting the elderly, going above and beyond, testing those in our care homes, restricting those that are old from having going out in the workplace and having jobs, because the working class is taking the brunt of this, but letting the younger generation get out there and get back to work. So it was an incredible conversation. It's now located on our Freedom platform. You can go watch the whole thing in its entirety, but it's important to know that this number that's thrown at you on a daily basis means nothing. The more tests we do, the higher that number is going to go, and it's got nothing to do with how this virus is affecting us. Leave your comments below. I'm curious what you think. Share this video with someone who might need it, and I appreciate you. We're going to keep asking hard questions until our leaders start making intelligent decisions. Thank you.